Hey, welcome to the
Doceree Dialogue,
a platform that unites industry leaders
Come together and exchange ideas, innovation, and insights.
shaping the future of healthcare marketing.
So thank you again for being part of Doceree Dialogue. So why don't we do this? Let's start off with some quick intros. Tell me your name, your title, what you do, the company, obviously, and then we'll just have a casual chat from there.
Lovely. So, Christine Lee, Head of Health Strategy and Partnerships with AnalyticsIQ.
Perfect.
So, I've been with AnalyticsIQ for a little over 5 years. My entire background is the data world, consumer data world. And so it's kind of a fun job to help connect to how consumer data and health data are coming together to bring better intelligence in
Fantastic.
general.
No, that's great. I love how the HCP kind of topic is surfacing more, right? It's like, obviously there's no shortage of conversations around consumer. However, the topic of HCPs are becoming more kind of present, which is great. And it's good for the category. I think it's good for everyone to start thinking about. And I know that you all play an important role in that as well.
Well, we like to say providers are people too.
That's it.
We like to say businesses don't make decisions, people do. And so that kind of thought process from a business standpoint translates nicely over to professionals. And care professionals are the name of the game here. So,
Yeah, absolutely.
Yeah.
So speaking of, this is a good segue into my second question for you is, let's talk a little bit more about Analytic IQ. Like, tell the audience a little bit about your key differentiators out in market that you focus on so that folks are educated about it.
absolutely. So, AnalyticsIQ, we're really a people-based data creator.
Okay.
And so what that means to the healthcare space and the healthcare marketing space and pharma marketing specifically is that we can help provide an added layer of intelligence about who providers are as individuals.
Yep.
Right. So you've got to have that clinical intelligence that is foundational.
Yep.
But then you want to make sure that you're also not just talking to the right HCPs, but talking to them in a behavioral way that has context about their lives and show them that you understand them. And that empathy goes a long way, I think, with providers and builds the trust. So we're really trying to be that added layer that comes in and brings consumer grade marketing intelligence into the HCP world.
Yep.
But yeah, we're really foundationally building data about who people are, what they do, and why they make the decisions they do in their lives. But that also, again, overlaps between their personal and their professional worlds.
Yeah.
Which ours do, right? Like,
Absolutely.
I can't say that I turn off work.
Yeah.
We're
Yeah. I
we're
wish we
living-
could.
I
Yeah. But
know.
yeah. Yeah. No, I think that hits the nail on the head. It's like when we start to think about us as professionals and us as human beings, it's a gray area, right?
Yes.
It's just like there's no clear line all the time. There may be presentations that we have to turn on a little bit more on one side, but it all comes from who we are as an individual, and it affects decisions. It affects how we kind of treat individuals around us. And in this case, from an HCP standpoint, this is also how they're making clinical decisions, right? Empathy in terms of how they digest data and kind of the signals that they're using around them to kind of inform them on their next step.
Absolutely.
Yeah.
Absolutely.
And so that's also a good segue. You mentioned this earlier, identifying the right HCPs. So how do you kind of think about that in from the perspective of your data set, utilizing your data to identify the right HCPs?
Yeah, so we do have the ability to help support teams in identifying HCPs based on, say, specialty.
Okay.
In those specialty areas, we can
Yep.
certainly align back to that people-based intelligence. So you can know if you're speaking to an oncologist that's also more innovative in their decision-making style.
Got it.
But for us, we really see the greatest value come into play when teams are bringing our data in as that behavioral intelligence.
Got it.
Because just targeting based on a specialty category doesn't consider treatment profile. It doesn't consider the patient side, right? And so that's what we're understanding is the most important piece is that patient data is also connected to the provider data and that's a part of the targeting. We do not provide any sort of patient data that's
Got it.
not connected to ours, but our, again, data is an added layer to say, we can tell you how these providers make decisions.
Yep.
As a person that can align to your decision, your tailoring of the messaging. But then our data from like a social driver of health standpoint
Right.
and I'm getting a little bit away from the question about targeting the right providers, but I personally believe it's fundamental and important that you have to start with the patients.
Yep.
And then you're getting, right? Because you're not talking to that provider about starting a new therapeutic. Maybe you are, but if you are, they're a patient in that instance.
Right.
So what's impacting the lives outside of a clinical setting for their patient population? That's the other area where our data can inform things like social drivers of health, right? Access data. So I think you have to make sure that you keep your eye on the population you're trying to improve outcomes for when you're targeting each.
No, that makes a ton of sense. So speaking of the use of data, right, and coupling maybe even your data set with maybe even another data set, meaning like patient data, right? So they can be complementary to that, right? So, or no, the other way around in terms of you have the consumer-based data, but really kind of coupling that maybe even with clinical or kind of like claims-based data and so on. I've asked a number of our partners here and participants in the podcast, like about striking the right balance, right? Because we all know that when utilizing data, it's very easy to start using so much data that you're constraining too much of the buy. But we obviously know data should be a component of these buys, but maybe even using less is also detrimental to the success of the campaign. What is your advice or thoughts for audiences out there that, maybe listening to striking that right balance of using enough data to basically target the right audiences today?
And not target them down so much.
That's it.
You have to.
Yeah,
to prepare
exactly.
your reaching.
Exactly.
And then there's the compliance component that they have to factor in. So there's
Exactly right.
such a harmony in a symphony that they have to create that harmony from, I should say, where I think about it is know a core HCP audience because you've got insights that tells you this is really who we probably directionally should be talking to.
Right.
Layer all of that additional insight into their patient populations, access challenges, their language barriers, their personalities and decision-making styles, and the providers, if they're bilingual, right? Like what channel preferences outside of a clinical setting are they likely to engage with? If they're more conscientious and conservative in their decision-making style as an HCP or more tech-forward and innovative, all of that data I would use to personalize. I wouldn't consider it as much of a use it to narrow down the audience.
Got it.
Layer it on for how you're going to segment or tailor the message to them in a more meaningful way that's going to resonate with really the real people on both sides of the diagnosis.
Right.
I think is how to think about that, because you're right. The more data sometimes can truly whittle down that audience
Exactly.
in that universe.
And it could work for you or against you, right? Yeah. So it's just striking that right balance, I think, is important. And I think that your answer was spot on. So as we, start to think about that and double click further, do you have an example or maybe even a success story that you might want to highlight of utilizing your data in maybe some similar setting?
Yeah, there's one that always comes to mind because I think it's a great example of leveraging insight on talking to the providers differently based on what you know about their patient population.
Right.
And what you know about the providers themselves. So there is a PTSD study. This is more clinical trial focused. And we're really struggling to get the participants who signed up to go through all the way through the trial.
Got it.
A lot of drop off. And so what they needed to do was understand the non-clinical factors impacting the patient population that was originally promoted to and invited to participate. So they had to look at a lot of the access areas in that particular area where there was a high percentage of PTSD diagnosed patients.
Got it.
And they looked at basically building out a segmentation system that would say, okay, community context, socioeconomic factors, transportation barriers. Like they didn't know why there was such drop off. And you could make some assumptions with PTSD that's very challenging and sensitive,
Of course.
condition. But it wasn't just that. And that's what they had a gut instinct on. And they validated that with data about the population outside, again, of what they know within the four walls of clinical setting. And then they were able to message to the providers to help get the message to those patients to invite them and help kind of essentially get them,
That's great.
hold their hand through and get them to complete the trial. But they talked to them in different ways. So if they knew there was more of a transportation access, this segment versus this segment maybe had some other, so say social isolation component.
Got it.
And maybe there was a socioeconomic factor impacting this other segment of that population, each of the providers they essentially segmented the providers too. So say there's 4 patient segments.
Okay.
There's 4 provider segments, and they talk to the providers based on what they knew about the patient population's barriers in a different way. And they were another channel to help advocate for and communicate to those patients. Perhaps they could give them a transportation voucher and support them in that way, or
Makes sense.
other just community like contextual signals to have empathy and build trust and continuity to get them essentially the message to them in a way that would ultimately improve the adoption of the clinical trial. So they were able to get the right messaging in front of these folks in a way that helped to secure more of the recruitment, but all the way adoption all the way through the clinical trial. So that one really stands out to me as impactful because I think it also, again, is an important piece of like a very sensitive condition, very challenging to get the message right.
Right.
And they leveraged data that goes beyond the claims and the EHR, and they brought it all together.
Yep.
And it was a cohesive message.
Yeah, that's great. That's a really strong and powerful example. In fact, as you were talking through that, I was thinking, wow, it's like the data not only informed the areas that may be like where we had lack of adoption, but also maybe the factors that were kind of contributing to that. And even more so, that data in itself, that findings then inform the providers to be able to tailor the messaging to those kind of populations that you needed to get more adoption from. So it was a multi-pronged approach, it sounds like, which is fantastic. And it's kind of like all work harmoniously together, which is fantastic. That's great. So I'm going to switch gears a bit and talk a little bit more about our partnership, which I'm super excited about. You know, AIQ is a very kind of like, important partner to us here at Doceree. Obviously, we're working with you on the marketplace today, and I'm sure that you're working with other partners in this capacity as well. However, I'd like to think that we're special, right? We have a special place in the AIQ's heart. One thing that I'd love to kind of highlight here on this podcast is hear a little bit more about your motivators for participating in environments like Doceree's marketplace, right? What are you hoping to get, and what are some of your goals with participating in other platforms like ours to allow your data to be made available and accessible to the kind of larger ecosystem?
I think when we are looking to partner with folks like Doceree, you all are really covering so many areas of trying to bring meaningful data together in a way that's digestible, but also thinking about some of that unique data out there that maybe isn't getting as widely adopted.
Right.
And so that to us is a key part of, we know we're valued in your marketplace, and that means a lot to us. I think that for us as well, where you can get the word out about more of this non-clinical data, we know 80% of everybody knows the stat, 80% of what impacts our outcomes is happening outside of a clinical setting.
Right.
Roughly 45% of mortality rates are SDOH driven.
Wow.
They're not based on clinical factors. So that for me it's important for us to be aligned in the right platforms with the right partnerships or teams that understand this is meaningful intelligence. It's going to drive greater HCP engagement. It's ultimately going to foster more trust and empathy. I think empathy is a superpower.
Yes.
As many places as we can plug it in, I'd love to see that. And so, just for us, we are not HCP engagement experts at AnalyticsIQ. We're consumer people-based data experts. And so where can we help to find the right place to plug that data in a meaningful way for teams who are going to get it, or at least be open to exploring further?
Right. That's fantastic. One last question for you that I'm asking everyone. I'm going to read this here. If you could have one superpower to make HCP engagement more impactful tomorrow, what would that be and why?
Okay. So this isn't what superpower would you choose as a person, just in general. This is very specific. So I would say if I could create a portal or portals between the clinical and the medical, the research and the marketing side of pharma marketing in general, so that they could communicate, innovate, and continue to adapt with insights about what they're all learning along the way, and it closes the loop completely. I would create that portal just for them, period, because they need it.
Yeah.
And can you imagine ultimately what that's going to do to improving outcomes?
Yeah.
So I think everybody would just be grateful to hop back and forth between that portal and hopefully do good with data.
You know what's interesting? What's interesting, Christine, is like everyone, I've asked everyone consistently this question intentionally just to see everybody's answers. And there's absolutely a single thread that goes through all of these kind of discussions, whereas everybody wants to make sure that we connect the dots. They want to do it faster. They want to make sure that everyone's speaking with one another, all of these platforms, because it is fragmented today, right? And we could all kind of benefit from this by having more kind of concise, consolidated info to inform kind of better patient outcomes going forward. So I'm so glad that you said that. It definitely resonates with me. I really appreciate your time spending with us today. Well, obviously, we really enjoy you as an individual. We enjoy our partnership. We really want to scale going forward. And yeah, we're looking forward to growing with you in the future.
Thank you for having me on Doceree Dialogue.